from our, there it is, I was waiting for it. This topic has come up a couple times in some of the discussions in the cases. And as I went to look at this, it's the first time we've done a didactic on it. There is a ton of information in this area. So we really are just going to scratch the surface to look at some of the information that's available. There we go. So my objectives for today are to describe the potential link, how might nutrition and mental health even be connected. We're going to look at some of the literature. And again, this is a relatively high level look. I wanted to give you a taste of a few of the different, there's a lot of variability. So a few of the different options that are out there related to this. Most of it's going to be due to most of it's going to be related to depression. We'll talk a little bit about anxiety, but depression really had one of the more robust evidence bases. And then we're going to list some of the confounders. Why is this not nearly as clear cut as we would like it to be? So to start off, you are what you eat. There are quite a few different articles, as well as there are blogs that are out there. There are interest groups that really focus on encouraging different types of dietary choices. You can have absolutely any diet that an individual is considering be glorified and villainized within the same platform. So I think one of the things that is going to be really important to keep in mind is none of the evidence I'm going to talk about, nor any of the recommendations that I've seen have said you absolutely need to do X or Y. So it really is going to be something that's patient-based, something that's going to provide some degree of balance. We can make choices, but rigid, very strict diets will be okay for some patients, but maybe not for others. So we're really not looking for something that's absolutely 100% concrete, black and white for all patients. So it's going to be messy right from the beginning. So recognizing that, the role of nutrition tends to play a more obvious, I'm a little biased. So I was just in New York and we saw my cousin and his wife just had brand new twin baby girls. And she had 4 different types of formula. So she is breastfeeding, but there were 4 different types of formula and each of them were promoting something different. I think some of the links with nutrition tend to be most obvious when we think of initial development. So those infants, those little newborns, they were 3 weeks old and absolutely adorable. Making sure that they have all of the nutrients, vitamins, minerals, and balance of amino acids and lipids so their brain can grow and develop and function. We tend to think about that definitely for pediatric and adolescent patients, but there's more and more interest in seeing the impact of what we eat as adults and how that continues to play a role with the potential development of both neurologic and mental health concerns. One of the developing areas is in the realm of Alzheimer's. I stayed a little bit away from that, but encouraging nutritional decisions to impact overall cognition and the eventual development of dementia. And some of that is related specifically to the health of the neuronal tissue. For other mental health conditions, we see a little bit of evidence about anxiety disorders. There's some evidence related to autism spectrum disorders, but quite a bit has been focused on mood disorders, specifically looking at depression. And the functional pieces, the structural support of the amino acids, the lipids, the vitamins and minerals haven't been as well explored. There is definitely some interest in looking at supplementation with different vitamins and minerals for patients with depression, going down the folic acid path. That's been looked at a couple times. But more of the interest is coming in terms of the actual linkage between the brain and the gut and the development of neurotransmitters, the neuroendocrine hormones that seem to play a role in neurotransmission that are mainly found within the GI tract, as well as the role of the gut microbiome. There's more and more evidence to suggest that the gut microbiome may play a huge role. It's suggested that that may be one of the larger organs in the body that has neurotransmission, that's releasing neurotransmitters and impacting how the rest of the brain is working. So there's much more interest in looking not just at what the food does for the brain itself, but what the food does for other organs and how that impacts the brain and ultimately the development of other mental health conditions. So still developing, there is a ton of interest that you could go down the celiac disease path. I looked at overall nutrition and mental health and suggestions related to that. Because it's supposed to be a brief didactic, I also tried to focus more on interventions that looked at counseling and dietary choices versus those that use nutritional supplements. We could do a full talk on any of the nutritional supplements on their own. So what evidence is available, recognizing there are all of those different considerations, and that may be how nutrition plays a role in the development of depression. This first trial that I looked at, there's quite a few reports, anecdotal, some are open label, some are non-randomized case series type things. This was one of the actual randomized controlled trials. Most of them are not double-blinded because the patients they're making their dietary choices. So they are a little bit more informed, which causes some methodological issues. This was a 12-week parallel group, single-blind randomized trial. So the investigators were the ones that were blinded. These were all adult patients that had been diagnosed with depression. They used the Montgomery-Åsberg depression rating score, and all of the patients at baseline fell into moderate or severe depression. Of these patients with depression, they were split into two different groups. One of the groups was given adjunctive dietary interventions, and they had 7 counseling sessions. The other group was given general counseling sessions, so more social support, cognitive behavioral therapy, but no interventions that were different from what the dietary group had had. So it wasn't something new that they were being exposed to, just kind of more of the same. So they had the same social touches over that period of time. What they were looking at was they wanted to see the change in the Montgomery-Åsberg depression rating score. How did their depression scores change over time? All of these patients were currently engaged in treatment. 2/3 of them were actively engaged in therapy, some of them group therapy, some of them individual therapy. Some of them had combination treatment with therapy as well as antidepressant treatment. And then there was a small subset, about 10 to 15% of the patients were only taking antidepressants alone. So they had that, they had been on treatment and stable on treatment for at least the past 2 to 3 months, but still were continuing to have moderate to severe depression. At the 12-week endpoint, they reevaluated the MADRS score, and they found that patients who dropped below a 10, who were essentially considered to be in remission compared to their baseline, it was 1/3 of the patients in the diet group. So 32.3% of the patients that had the dietary intervention were in remission of their depression symptoms, while only 8% of the patients in the control group. There wasn't found to be any detrimental effects from having the additional dietary intervention. There weren't side effects that were reported or any other complications in those two groups. So the authors suggested that this could be a potential adjunctive treatment for patients who had not responsive moderate to severe depression. It was counseling sessions. So the dietary intervention were counseling sessions that tried to encourage the patients to make different dietary choices. It wasn't necessarily randomizing them to a specific diet itself. So I wanted to look at another trial that did just that. This was a 6-month-long trial. Again, it was only single-blinded. The patients needed to know what they were getting. And patients were assigned into 2 groups. So the first group was given what they described as food hampers. It was a pre-packaged meal plan for them. So similar to something like any of the meal plans, they totally, like Nutrisystem, like Noom, well, not like Noom because they don't send it to you, but they actually gave the patients here's what would be your breakfast, here's what would be your lunch, here's what would be your dinner. They did have to prepare it, So they did need to do some cooking, but for the most part, it was not intensive instructions or recipes that they needed to follow that were multi-step. It was, everything was there and they just needed to put it together. So they were given those food packages. They also attended workshops that were focused on dietary choices for over 3 months. Those food hampers were set up to be a Mediterranean diet. So it was different from baseline for all of the patients, but it was set up to be a Mediterranean diet. Those patients were also given fish oil supplements for 6 months. The other group was called the social group, and they did have additional workshops, and they were had a placebo supplement that they did administer over the 6 months. So they wanted to ensure that it wasn't just the socialization of the workshops for the first 3 months that made the difference. They included over 150 patients that were adults that either had a diagnosis of depression or were self-reporting depressive symptoms over the last 2 months. So it wasn't required that they had the diagnosis. They then wanted to look at what was the change in their depression symptoms from baseline. And this shows this was a better graph than the 6-month data. This shows the evidence at the end of 3 months, and it did continue for the 6-month time frame. Their rating scale that they used is the Depression Anxiety Stress Scale, so the DAS-21 scale. That dotted line that goes across at 14 is the line that designates where they would consider severe depressive symptoms. So as you can see at baseline in both the diet group as well as the social group, they both had their average baseline depression scores well over that threshold. So the vast majority of the patients were experiencing relatively severe depressive symptoms. At the end of 3 months, we saw a significant decrease in both groups, although the decrease in the diet group was significantly greater than the decrease in the social group. And the average for the diet group at 3 months, which continued through the 6 months, was below that threshold for severe. So patients may still have had moderate or mild symptoms, but the average overall was below that threshold. They only had, I think, 1 or 2 patients that had a depression scale that remained above in that severe category, so above 14. So they also felt that an intervention, a nutritional intervention, could be beneficial in the treatment of patients with depression. This was specific to a Mediterranean diet. Not all of the patients continued with all of the workshops. So they had about 70% attendance throughout the 12 weeks. It was relatively consistent between the 2 groups. But if they did have that additional support and they were given the food choices, this was found to be very beneficial. The authors do note that if a patient is just encouraged to do a Mediterranean diet, they may not get the same results, especially if they're not holding that diet to fidelity, because they actually had dietitians that set up essentially the food boxes for the patients. So these last 2 seem to suggest that, yes, we could potentially use a diet as adjunctive treatment in depression. We have another more recent trial that was done. So this looked at patients who were overweight or obese, so over 1,000 patients, and now they're looking at patients that had mild depressive symptoms. So can we back it off from just the patients who are relatively moderately severely ill with depression to those that may not have a diagnosis of depression and only have some of those mild symptoms? Will it help them, and does it prevent the subsequent development of major depressive disorder? So this was a huge trial. So it was a randomized controlled trial at a few different sites, and they randomized patients into 4 different groups. So the groups either got supplements or not. The supplements included selenium, folic acid, omega-3 fatty acids, vitamin D, and calcium that patients took twice daily. And then they were given a therapy group or no therapy. So the therapy in this case was behavioral activation therapy. So it was protocol based. They had their own manuals that the patients worked through. There was 21 sessions for all of the patients. 15 were individual, and then 6 of them were group. So they were split equally between those 4 groups. They then were tracking the patients over the course of a year to see if they were able to prevent the development of the diagnosis of major depressive disorder. The colored bars here correspond to the different groups because I couldn't fit all of the terms in the bottom. It got super busy. So 1 is placebo with no therapy, 2 is placebo with therapy, 3 supplements, no therapy, 4 is supplements with therapy. They didn't find a difference at the end of the 1 year in the number of patients who were diagnosed with major depressive disorder. It was between 8.5% and 12.5% of the patients in each group went on to have a diagnosis of depression. There were a handful of patients that did respond to treatment. They looked at their adherence and some of their dietary choices. All of the patients across the board had improvement in their dietary choices, where it was felt that they were making healthier decisions in their diet across the board, but they weren't instituting a particular diet in general. So they didn't feel that either the placebo or the therapy was really beneficial on the prevention side. For some of the patients, they did report an improvement in their quality of life and a reduction in those depressive symptoms. But from a clinically significant standpoint, they were relatively mild. And if they felt that they were making healthier choices, it wasn't clear that that was just from the dietary choices themselves or from believing they're taking supplements or going to therapy and having the social supports. So this seemed to suggest that maybe this won't play a role in prevention for treatment or prevention of treatment for patients that have only mild symptoms. So that's a snapshot at depression. I wanted to include something else. There wasn't a ton of other evidence. So I did look at anxiety overall. This particular article was a meta-analysis that was done. They included 16 randomized trials, but 15 of them allowed for patients to have depression and anxiety or just anxiety. So one of them was depression alone. There was a ton of variability between these different trials. So the duration of the trials were between 10 days and 3 years. And then they had a whole bunch of different interventions. In some cases, it was counseling. In some cases, they were encouraged to make dietary changes. In some cases, they were supplied with food for their diet over a short period of time. The reason that I allowed for all of that variability to be pooled together, so here's the 0 right here in the middle. To the left favors control, to the right favors diet. They really did not, across the board, see a significant improvement in anxiety symptoms. There were a couple trials that did demonstrate some improvement. Those were trials that included both dietary counseling as well as a diet intervention for the patients, and they did see some improvement, but some of the primary outcomes for them were quality of life outcomes. They felt like they were making better choices. And that was an indicator of whether or not their anxiety had improved versus being an actual rating scale of their anxiety symptoms. So overall, we don't have a lot of information to support that nutritional interventions are going to across the board improve anxiety. With that being said, the 2 trials that we talked about before, they did look at subscales of anxiety. And at least in the first one that we talked about that had the counseling, they did see an improvement in those anxiety symptoms as well as the depression symptoms. So there may be some patients that do respond well to this. Again, on the toxicity side, there were no drawbacks. There were a couple patients that were hospitalized, although it wasn't necessarily felt to be because of their nutritional intervention. It was likely due to an extenuating circumstance that had them be hospitalized. So it wasn't thought that it was completely caused by whatever the particular nutritional intervention was. So depression, maybe to help support treatment, maybe not so much for prevention. Anxiety, we kind of have a muddy picture. Maybe it can be a little bit of a help, but it doesn't look like it has a robust effect size, at least at this point. So does that mean that this evidence is solid? No, by no means. Unfortunately, the evidence for this is kind of soft. And 2 of the more recent reviews that have come out have essentially said they don't see a lot of support to encourage this as being one of the main interventions for patients with depression. Some of the reasons for that It's unclear the relationship between comorbid conditions. So if patients have a lot of other medical conditions, this could benefit them. They may feel better if they're making better dietary choices, and that helps get their diabetes or their hypertension under control. That may also help their depression. It may also be that while they've established correlation between mental health issues, depression, anxiety, and nutritional different diets that people are eating, it's not causation. So just because the percentage of patients who are using a Mediterranean diet is lower than patients who are on more of a Western diet, that doesn't necessarily mean that it's completely caused by that. It is suggested, and they are definitely looking at objective trials to prove that, but they've been really inconsistent with the biomarkers. So they haven't been able to establish that connection, and that makes it a little muddy. So is it just that patients who don't have anxiety and depression are more likely to follow that diet? That is a possibility. The diet types, most of the diets have been focused on having a very balanced diet, reducing the amount of processed foods, or they've been focused on something like a Mediterranean diet. So relatively balanced, but having an increased amount of some of the omega-3 fatty acids. Whether this would hold true for other types of diets is unclear, like the Atkins diet is unclear at this time. Financial considerations, it may be great, it may sound wonderful on paper to have a patient try to make a significant difference, but there may be financial constraints or geographic constraints that make it difficult for them to do so, especially if they're unable to get a greater variety of fruits and vegetables to help balance out their diets. Lifestyle can definitely play a role, including some of the socialization. One of the meta-analysis was talking about how just with the counseling and encouraging better choices, that can be difficult for some patients who their only socialization may be going out to dinner with family or with friends. So if there's a place that's local, if there's a place that's cheap that individuals go to, they may be really limited in what they can select there. So that may lead to some degree of guilt in their ability to make good choices. And sometimes when one choice doesn't go quite the way that they want, sometimes there's a what the hell effect where it's like, I didn't do that, so now I'm just gonna let the whole weekend go by. So sometimes there are other factors that really can play a role. The other, on the positive side, is in some patients who are making different dietary choices, they do feel more energized. So they may be feeling good about the choices that they're making and may be much more likely to engage in other healthy activities, including things like meditation. They may be much more physically active. So that actually could continue to amplify that effect, which would be separate from just the dietary interventions. Life stress can definitely play a role. And during different times, that may be difficult for patients to be able to continue, especially if the diet that they're wanting to follow requires a lot of prep ahead of time. There may just be busy times of the year where they're unable to do that, and that may be really stressful and therefore exacerbate their anxiety or their depression. And then the consideration of what is the goal? Are we trying to treat the disease, trying to have a booster or adjunctive effect, especially for depression? That may be a realistic pathway or treatment option for the patient. If we're looking to prevent some of the mental illnesses, we don't have nearly enough information at this point to be able to support that recommendation, as this alone can prevent the development of major depressive disorder, for example. So recognizing that there are a bunch of confounders that we have, if we look at some of the treatment guidelines, they do encourage lifestyle modifications and the incorporation of a healthy diet, keeping in mind that that healthy diet is the broad umbrella. So it needs to be patient specific. Balance would be best. But they don't necessarily need to make huge swings to say going totally vegan, completely vegetarian, we're changing everything to be Mediterranean. There is a way to be able to have a Western diet that's balanced, that still is relatively healthy. So just considering what their choices are and seeing what supports they need to encourage the utilization of dietitians or nutritionists to help with some of their decision making, which unfortunately is still not covered on a regular basis for, in a number of insurance plans unless they have a specific diagnosis. So in summary, there are theoretically linkages between dietary input, the nutritional choices patients are making, and mental health, both related structurally to the way that the brain develops and how it's supported, as well as the gut and all of the activity that's happening there. Our evidence is inconsistent on whether it can completely treat and prevent mental health conditions, but it does appear to be beneficial for adjunctive treatment in patients with moderate to severe depression. And with those limitations, it's going to take some time before we're able to get a little bit of a clearer picture of exactly the role that nutrition alone plays for mental health conditions. So with that, I will stop my share.